and applaud you for you championing silencing the guns to create conditions for peace and development during your tenure as chairperson of the African Union. As we heard the Secretary General reiterate yesterday, investing in young people and silencing the guns are precursor for social cohesion, sustainable peace and development. I was Minister of International Cooperation and African Integration when you visited my country as chair of AU, and your message was clear: solidarity to enable Africa to speak with one voice when working on inclusive growth. Such leadership is charting Africa's path forward, and when international partnerships are catalytic, aligned with national priority and ownership, they can accelerate progress in people-centered development. Here, UNFPA wishes to praise Japan's role. Through the TCAD supplementary budget and by promoting public-private cooperation, Japan has enabled African government and UNFPA to partner with leading Japanese companies such as NEC, Itochu, or SOIC to ensure dignity and survival of millions of women and girls across Africa. These partnerships are showing results. Digital platforms are preventing shortage of family planning supply. Real-time monitoring is improving maternal and newborn outcome. Digital cash transfer are supporting individual, family, and communities. Portable technology are putting life-saving tools in the hand of frontline health workers. This progress is the result of political choice to prioritize human capital, to strengthen resilient domestic system, and to invest in future generations. That will entail investing in digital literacy and culture, in safe and secure systems, and in governance framework that put women and young people at the center. UNFPA is proud to stand with African government and Japan in this work. Together with the private sector and civil society, we can invest in sustaining peace through a healthier, more equal, and more prosperous Africa. I thank you for your kind attention. Arigato gozaimasu.
Thank you, Dr. Dione Keita. Please give her another round of applause, please. It is now my honor to invite and introduce His Excellency Yoko Kamikawa to come to the stage. While she is coming to the stage, I would like to say that the former Minister of Foreign Affairs of Japan will be our keynote speaker. Her Excellency Kamikawa is the one who started, actually, this TCAD 9 process, leading the ministerial meeting last year in 2024. She's a dynamic thinker in development. Her Excellency has represented Japan at a number of high-level platforms, including delivering speeches at the UN General Assembly high-level meeting on pandemic prevention, preparedness, and response. She has been an avid advocate of women, peace, and security, and led a number of initiatives in and out of Japan. I'm pleased to say that she's also a strong supporter of the United Nations Population Fund. Without further ado, I call upon you, Excellency, to the stage.
On behalf of Prime Minister Ishiba, His Excellency Ishiba Shigeru, it gives me great pleasure to warmly welcome His Excellency President Cyril Ramaphosa as a keynote speaker for this important convening focusing on women's, children, and adolescents' health and rights. Your Excellency, the collective voice of the Global Leaders Network, which you are representing today in your capacity as chairman, remains crucially important in advancing our collective goals to advance sexual and reproductive health rights as an imperative towards peace and security for current and future generations. His Excellency Matamela Cyril Ramaphosa is the President of South Africa. He has held and continues to hold several critical health leadership roles, including as a champion of pandemic prevention, preparedness and response in the African Union, the chair of the Global Leaders Network for Women, Children, and Adolescent Health, and so co-chair with Norway of the Access to COVID-19 Tools Accelerator. At home, His Excellency personally oversees health reform in his country through the Presidential Health Compact. In the interest of time, we cannot go into His Excellency's entire biography. Suffice to say that we are honored to receive a keynote address from such an avid champion of health and rights. Your Excellency, we invite you to take the floor. Thank you very much.
Thank you so much. Excellencies, distinguished guests who are here, and the acting director of UN FPA, Diane, my sister, Keita, and honorable partners and agencies who are here present, various ministers and deputy ministers who are also here, and also partners from civil society who continue their deep interest in this matter that we're dealing with here today. But also more importantly, friends and partners from the private sector who continue to focus on the matter that we're dealing with here today. It is indeed an honor for me to stand before you as the chair of the Global Leaders Network for Women's, Children's, and Adolescents' Health, alongside fellow members from Ethiopia and Nigeria. The Global Leaders Network is a coalition, as many of you might know, of a number of heads of state and government who are united by a conviction that the health and dignity, as well as the potential of women, children, and adolescents are the cornerstones of what I would call a fair, prosperous, and a peaceful world. The reality that we must confront as we deal with the challenges that faces the women of the world, particularly in developing economy countries, is that too many women still die in childbirth of preventable causes. This is something that we all collectively need to commit ourselves to resolving. Too many children and adolescents still suffer and die from illnesses that we now know we can prevent and we can also treat.
These are not inevitable tragedies. They are not inevitable diseases or ailments. These are treatable as well as preventable illnesses. Just as every avoidable death is a policy and an administrative failure, every life that is saved is the result of a political will, as well as action that needs to be taken. Global Leaders Network commits at the highest political level to keeping the voices of the most vulnerable alive in the halls of power. The moral imperative is quite clear in this regard. No woman, no child or adolescent should die of preventable diseases in this day and age. We must stand firm against the reversals that we are witnessing in sexual and reproductive health and rights, particularly of women. We believe that every woman has autonomy over her sexuality and reproductive choices. Every adolescent should get comprehensive sexual education. Every person should be free from sexually transmitted diseases. To translate conviction into action, the Global Leaders Network has identified 3 priorities for immediate and sustained action, as well as focus. Firstly, as countries advance in their own development, and as they also advance universal health coverage, we must, as we do everything else that we need to do to advance the best livelihood of humanity, we must place women, children, and adolescents at the center of the design and implementation of universal health coverage. Health services need to be safe. They also need to be effective. They also need to be underpinned by compassion and must be responsive to the lived realities of those who need them most. Our second priority is to increase investment in women's and children's and adolescents' health. As official development assistance is cut, many countries are pursuing domestic resource mobilization as a sustainable health financing solution. However, as they do all this, we must continue to foster the principle of solidarity through multilateral financing solutions. This includes the consideration of a gap financing mechanism to address the needs of countries and communities most affected by the withdrawal of official development assistance. As we know, there is a reversal, there is a reduction of development assistance when it comes to health. And as this is being done, it obviously reduces our commitment to solidarity. We've always believed that solidarity is important as we deal with the challenges that many people in the world face, particularly vulnerable populations. Our third priority is to uphold sexual and reproductive health rights. The data is clear. A lack of access to safe abortion leads to a higher incidence of deaths, costly, complicated, and permanent damage leading to infertility. And this immediately impacts negatively on the rights that women should have. I do call on governments, but also on financing institutions, development partners as well, civil society, and the private sector to push forward towards 2030 with the following convictions. Firstly, we should reaffirm and protect funding for women's, children's, and adolescents' health as a core pillar of development cooperation, even amidst shifting global priorities. Even as funding is being reduced, even as we face economic challenges as a result of the geopolitical situation, countries should continue to protect the funding that should go for women's, children's, and adolescents' health. Secondly, we should integrate health into broader and climate strategies. Broader development and climate strategies, that is, recognizing that resilient health systems are essential for adaptation, recovery, and long-term sustainability. And thirdly, we must continue to invest in innovation and digital health solutions that bridge gaps in access, particularly for rural and marginalized communities. My sister, Diane Keita, earlier stated that a number of countries on our continent, the African continent, are surging ahead with digital solutions when it comes to health. And we would like this to be widespread because the utilization of digital solutions do improve access and do improve our focus on health matters. Finally, we need to ensure that there is accountability so that commitments that we make, that everybody makes, should translate into measurable improvements in survival, well-being, as well as equity. As we make improvements, the whole concept of accountability we must be able to measure precisely whether we are making progress or not making progress. So accountability must come alive. It must speak to the lived situation that people are living under. It must not just be a theoretical concept. It must address what happens in our health systems, in our hospitals, in our clinics, in our health ecosystem as a whole. The cost of inaction on these issues will be counted not only in lives that are lost, but in futures that are diminished, communities that will be destabilized, and economic opportunities that will be forgone. A large measure of what we are discussing here at TICAD is about advancing the economies of our countries. But if we don't focus on the issue of health, even those areas of progress that we want to make in the economy, in the future that people should have, will be diminished. So health impacts very directly on the economy, on the future well-being of people. But the benefits of bold and coordinated action will build social, economic prosperity for generations. What we do now when it comes to health, as we focus on the health of women, children, and adolescents, will pay dividends and abundant dividends going forward. Women, children, and adolescents must therefore be our priority, for they, in more ways than we can imagine, represent the future that we are all working so hard to secure. And it is when we focus on all that will advance the well-being of women, of children and adolescents, that we will be able to build better nations, nations that will succeed in the future. So we have a great opportunity, all of us, to do what I regard as very simple, to take care of the health of women, children, and adolescents. And this is the time to do it. I thank you.
Thank you again, Excellency, Mr. President. A big round of applause for President Ramaphosa, please. We will now go straight to a photo picture, and we will just, the logistician will be moving this desk, and I would kindly like to invite you, again, Mr. President, and distinguished guests, podium here for the photo. And I will communicate the logistics. Please come on stage. Because you have two rows. So we have the lady.